So we are on page 455, again, chapter 11, hair removal. Okay, let's talk about explaining the importance of hair removal. So consumers in the United States, you guys, they spend millions of dollars a year on hair removal products and services. And we want half of that, don't we, by offering waxing services to our clients. So today, hair removal methods range from procedures such as waxing and tweezing, so to more advanced techniques that require special training, like for example, laser hair removal and electrolysis, intense pulse light, IPL, face and body hair removal has become increasingly popular as evolving technology makes it easier to perform with more effective results for both men and women for aesthetic purposes, sport performance. Estheticians should study and again have a thorough understanding of hair removal because the growing popularity of hair removal makes up a large part of a salon business and is one of the most lucrative services offered. So waxing is the most common method of hair removal in salons, making it an important service to learn because you want to be proficient in it and you want to provide it. So understanding the benefits, the risk, and how to perform various techniques is a vital part to becoming and being an esthetician, and of course being successful and in this very profitable market, right? You definitely want to know what you're doing when it comes to all the services that you will be offering. Knowing what method to use, the room preparation, safety, and of course infection control procedures are very important part of removal procedures and of course practices. All right, please highlight and put a star next to the following. We are on page 456, describe the structure of hair. Put a star next to the scientific study of hair and its diseases is called trichology, okay? Trichology. The average human is born with skin that houses approximately 5 million pilosebaceous units capable of producing hair. It is important to understand all aspects of hair, including its structure, its appendages, and the types of hair found on the body. This will help you to suggest and provide the best hair removal service to all of your clients. Next, the hair follicle and its appendages. Please put a star next to the following. A hair follicle is a mass of epidermal cells forming a small tube. Okay, please highlight that. A small tube or canal. Follicles extend deep into the dermis. The pilosebaceous unit, okay, contains the hair follicle and its appendages, which include the hair root, the hair bulb, hair papilla, hair shaft, and the erector pili muscle and sebaceous glands. And as you guys can see, there's a picture of it on bottom of page 456. All right, 457 at the top, follicular canal. So the follicular canal is lined with the epidermal tissue. These epidermal cells produce the follicle and hair matrix. The matrix is where cell mitosis happens. Okay, that's where division starts to happen. The hair root, and I have all of that highlighted, you guys. So the hair root anchors hair to the skin cells and is part of the hair located at the bottom of the follicle below the surface of the skin. The root is part of the hair that lies within the follicle at its base where the hair grows. Please put a star next to hair bulb. The hair bulb is a thick club-shaped structure made from epithelial cells that surround the papilla. This forms the lower part or base of the hair follicle. This is where hair grows from cell division. The lower part of the bulb fits over and covers the papilla. The hair bulb contains the dividing cell of the hair matrix that produces the hair in both the external root sheath, okay, and internal root sheath lining the follicle. The external root sheath is made of horny epidermal tissue. The internal sheath is the innermost layer of the follicle closest to the hair. The internal sheath is the thick layer of cells you see attached to the base of the hair when epilating it. All right, hair papilla. It is a cone-shaped elevation of connective tissue that contains the capillaries and nerves located at the base of the follicle that fits into the bulb. The hair papillae are necessary for hair growth and nourishment of the follicle. The blood vessels bring nutrients to the base of the bulb, causing it to grow and form new hair. Sensory nerves surround the base of the follicle. Then we have the hair shaft. So the hair shaft is defined as part of the hair located above the surface of the skin. As cell division within the hair matrix happens, the hair grows and gets longer. Keratinization is completed by this time. These cells approach the skin, occurs, the hair grows and gets longer. Keratinization is completed by the time these cells approach the skin surface where the hair shaft protrudes from the skin. That's where we're able to see it. This is similar to skin cell division and migration. So the basal cells in the hair matrix divide and form the three main layers of the hair shaft, the cuticle, the cortex, and the medulla. The cuticle is the outermost layer. The cortex is the middle, and the medulla is the center or the innermost layer of the hair shaft. The two outer layers of the shaft are hard keratin, and the inner layer is soft keratin. Okay. Please highlight and put a star next to the following. The sebaceous gland secrete that waxy substance called sebum, which lubricates the skin and hair. This helps keep the skin supple and waterproof and protects against external factors. All right, top of page 458. The erector pili muscle contracts when affected by cold and other stimuli. It pulls on the follicles and forces the hair to stand erect, causing goosebumps. We've talked a little bit about the erector pili muscle when we were going over the different layers of the skin. I hope you guys can remember that. This reaction is also thought to keep the skin warmer by creating an air pocket under the upright hairs. The muscle contraction also helps disperse the protective lipids from the sebaceous glands to the skin and to the hair. All right, so list the types of hair. There are three major types of hair to be found on the human body. Here we go. We have lanugo, vellus hair, and terminal hair. Okay, so let's start with lanugo. Please put a star next to lanugo and highlight it. Lanugo is soft, downy hair that is found on a fetus. Okay, the lanugo hair sheds after birth and is then replaced with either vellus hair or terminal hair. Vellus hair, you guys, is found in areas that are not covered by large, coarser terminal hairs. So for example, vellus hair usually grows on our cheeks, right? Also known as peach fuzz. Removing vellus hair, especially against the hair growth, can result in the follicles producing new terminal hair. So it is not recommended to tweeze, shave, or wax these fine hairs. Okay? Do we do it anyway? We do, don't we? All right. Terminal hair. Terminal hair is the longer, coarser hair that is found on someone's beard, our eyebrows, our lashes, genitals, arms, and legs. So with hormone changes during puberty, the follicles are naturally regulated to switch from producing vellus hair to producing terminal hair in these areas. So it becomes a lot thicker, coarser, right? All right, now let's talk about the hair growth cycle. This is very important. I always say that in every chapter. I know, I'm sorry, but everything's important. But put a star next to the following. Hair growth is a result of the activity of cells found in the basal layer. So these cells are found within the hair bulb. Hair growth occurs in 3 different stages. We have the anagen, catagen, and telogen. A-C-T. A-C-T. Anagen, catagen, and telogen. These stages, you guys, vary in duration on different parts of the body, okay? So for example, scalp hair, okay, has a longer anagen phase, so the hair on the scalp can grow down to the knees in some cases. Can you believe how, would you want to have hair down to your knees? That is very long. So conversely, eyelashes have a relatively short duration of the anagen phase before shedding and being replaced, which is why we do not need to get our eyelashes trimmed, because they simply just fall off, right? These cycles can also be determined and affected by many factors, including age, genetics, hormones, and a person's health and prescription drugs. So again, using the acronym ACT, A-C-T, to remember the growth stages sequence, hair follicles in any given part of the body will be they will be in different phases at any given time, okay? Even our eyelashes, they grow at different times. So anagen, if you look at on page 459 at the very top, so we have the anagen phase, again, catagen, telogen, and then it returns back to the anagen phase. So an anagen will be those tiny, small, I'm just going to work with lashes to give you guys an example. So the smaller lashes that are perhaps in your inner corner or in between the middle of your lashes, they are perhaps at the anagen phase, baby lashes. Your catagen will be your medium length lashes, and then your telogen lashes, which tend to be more noticeable sometimes in the middle of your eyelashes. They are the longer lashes that will soon just shed, right? And then return back to a new cycle. So again, that's a really good picture there on top of page 459. So again, let's start from the beginning. Anagen phase, please highlight those first 2 sentences. The anagen phase is the growth stage during which new hair is produced, okay? New keratinized cells are manufactured in the hair follicle during the anagen stage. Activity is greater in the hair bulb, which pushes down into the dermis and swells with cell mitosis in the matrix. Stem cells at the junction between the erector pili muscle and the new follicle grow downward and stimulate cell mitosis in the matrix. New cells form hair and root sheaths while the older part of the hair is pushed upward. Once the hair has reached its full length, you guys, it can remain there for weeks or even years, depending on the location of the hair in the body. So for example, the hair on our scalp, okay, will be there until what? Until we cut it, or it's dry and damaged and it just kind of falls off, right? So, oh, there it goes. Hair on the scalp, okay, remains in the anagen phase for years. Other areas like eyelashes have a short anagen phase. The length of the anagen phase determines the length of the hair, okay? This stage is the most important stage for estheticians in effective hair removal. All right, next page, page 460 at the very top. Please highlight and put a star next to the following. As removing hairs during the anagen stage will be more effective for long-term hair reduction. All right, next will be the catagen phase. You guys, they will ask you about the hair growth cycle on your state board exam, okay? So there's no way around this. You want to remember these: anagen, catagen, telogen, ACT, okay? All right, the catagen phase is the transition stage of hair growth. In the catagen stage, mitosis ceases. The hair having completed its growing phase detaches itself from the derma papilla. The follicle degenerates and collapses as epidermal tissue retracts upward. Hair loses its inner root sheath and becomes drier. The mature hair is now referred to as a club hair, okay? The base looks like a club. This is the shortest part of the hair growth cycle. Put a star next to telogen, all right? Telogen, highlight it. The telogen phase is the final or resting stage of hair growth. During the telogen stage, the club hair moves up the follicle and is ready to shed. The hair is at its full size and length and is erect in the follicle. It is clearly visible above the skin surface unless it has already shed, right? The hair bulb is not active and the hair is released and it is attached only by epidermal cells. Hair may sit in the follicle until it is pushed out by a new anagen hair or falls out on its own. In some cases, the hair may share the follicle with a new anagen hair, giving the appearance of two hairs coming out from a single follicle. I don't know if you guys have ever seen it, but it is possible, and you might start to notice it, especially as you start to do underarm waxing, okay? The appearance, okay, the empty and dormant follicle is latent, okay, until the cycle begins again with a new anagen phase. I think I've even seen like 3 hairs come out of one follicle before. It's definitely different, but you will notice it as you start to wax. All right. Identify the causes, you guys, the causes of excessive hair growth, all right? The amount of hair an individual has differs from person to person, okay? What would be normal hair growth in one person might be extreme in another. Hair growth in terms of density on the scalp, face, and body is determined by genetics, okay, and ethnicity, as well as health and, of course, hormonal influences. It is important to recognize the difference when assessing the client for hair removal services. Top of page 461. Hypertrichosis versus hirsutism. Hypertrichosis is an excessive growth of terminal hair in areas of the body that normally grow only vellus hair, okay? And not necessarily in the adult male hair growth patterns. This type of hair growth is genetically and ethnically inherited. I'm sorry, I can't see. There's a big old glare. But can also occur due to the natural life occurrence, okay, such as puberty, pregnancy, and menopause. Certain medical procedures and treatments, like cancer, for instance, or reaction to certain medication, like steroids, it is not stimulated by male androgens, and while there may not be a cure to address the cause of the superfluous hair, it may be treated aesthetically. Hirsutism. So hirsutism is excessive hair growth, okay, on the face, chest, underarms, and the groin, especially in women, okay? It is caused by excessive, male androgens in the blood. This hormone imbalance may be caused by stimulation of male androgens at puberty, medication, illness, and stress. It can be resolved by eliminating the cause of the condition. So excessive hair growth on the female face or body may be attributed to hormonal imbalances and excessive androgen production secreted from the ovaries or adrenal glands. Menopause may also cause excessive facial hair. These changes may dissipate with time and medical attention. You want to let your clients know, like, hey, I know you see the hair there and it's bothering you, but it is best to let it grow out a little bit longer, anywhere between 4 to 5 weeks, and then come in. The clients who typically wait 4 to 5 weeks will actually get the best wax and the best results, okay? Everyone is a little different. You will have clients that they come see you regularly every 3 to 4 weeks, and then you've been waxing them for so long that they will come in with like a few hairs. Of course, that's not the best way to, like run a business, because you want them to come see you. But there are clients that after getting waxed so much, they just stop growing hair. So excessive hair growth may indicate a medical issue, and there are a number of documented diseases, disorders, and syndromes that, when diagnosed and treated, can reduce the problem of hirsutism, a disease of pathological-like conditions caused by viruses and bacteria, with a series of signs and symptoms. So a disorder of an abnormality of functions, like a birth defect or genetically inherited malfunction. A syndrome is a group of symptoms that, when combined, characterize a disease or a disorder. Okay, so please put a star next to the following and highlight it where it says diseases affecting hair growth. So medical conditions related to excessive androgen production that affect hair growth are acromegaly. Okay, acromegaly and Cushing syndrome. Please put a star next to that. It will be on your chapter 11 test. Disorders affecting hair growth. Again, androgenital syndrome is a malfunction of the adrenal cortex that causes an overproduction of androgens. Page 463 at the top, syndromes affecting hair growth. So the most notable and prevalent syndrome relating to hair growth is PCOS. I just mentioned it, polycystic ovarian syndrome, formerly known as Stein-Lethal syndrome. An individual with this syndrome would present with hirsutism, irregular menses, ovarian cyst, and obesity. Another notable syndrome is Achard-Thier's syndrome, which is a combination of Cushing and adrenal genital syndromes. So on page 463 at the bottom, compare temporary and permanent hair removal and hair reduction methods. Please highlight and put a star next to the following. Methods of hair removal fall into two general categories: temporary and permanent, including permanent reduction. So temporary hair removal involves repeated treatments as the hair grows. With permanent removal, what happens is that the papilla is destroyed, making regrowth impossible. Spa and salon techniques are generally limited to temporary methods such as waxing, sugaring, threading, and some may offer electrolysis as a permanent method of hair removal. Some states allow laser and IPL hair removal that offer permanent reduction. Medical spas or medi-spas with physicians on staff offer laser and IPL hair removal, but rarely temporary methods. Okay, so usually spas will offer, again, laser, but a lot of spas, like med spas, will not do a whole lot of waxing. All right, so temporary methods, home and professional. Put a star next to the word depilation. Temporary methods of hair removal include depilation and epilation. You guys, depilation is a process of removing hair at or near the level of the skin. Both shaving and chemical depilation are included in this category. Okay. Another temporary method of hair removal is epilation, the process of removing hair from the bottom of the follicle by breaking contact between the bulb and the papilla. The hair is pulled out of the follicle. Tweezing, waxing, sugaring, and threading are all methods of epilation. So, depilation, the main method of depilation will be shaving. Also, you guys have heard of nares, all right, or veet. So that will be another method of depilation. And of course, epilation, the main one will be waxing, sugaring, threading, okay? You're removing the hair from the root, okay? And there's a picture there on page 464. Now, tweezing and electronic tweezers. The method of using tweezers to pull hair out by the root one at a time is called tweezing. Eyebrows can be shaped and contoured by tweezing. Tweezing is also used on remaining hairs after waxing. If clients are sensitive to waxing, tweezing is a slower but effective alternative for removing the dark, coarse hair that is on the face. Another less common tweezing method used is electronically charged tweezers, okay? The tweezers are used to grasp a single hair and transmit radio frequency energy down the hair shaft into the follicle area. The idea is that the papilla is desiccated and eventually destroyed. However, the efficacy of this method is controversial as the hair is not a good conductor of heat or radio frequency. Electronic tweezers are not a method of permanent hair removal, and the process is slow. Separate licensing may be required to perform electronic tweezing in some states. Let's talk about some pros of tweezing. So, minimal cost after purchase of good pair of tweezers, and they're obviously very convenient to use, all right? Tweezing cons would be it can be uncomfortable and even a little painful. Eyeglasses impede tweezing. Obviously, if you're going to be tweezing someone, you would tell them to remove their glasses, right? Poor vision makes time consuming, okay, and laborious for clearing dense growth. Only feasible in small areas. That's true. Like I mentioned earlier, when we try to sit there and tweeze someone's entire chin, it's very hard. And well, it's not that it's hard, but it is time consuming for sure. Hair's broken sometimes with tweezing and can create bumps and pimples. Okay. All right. Shaving. All right. So with shaving, as with any depilation method, the hair is removed down to the skin surface. It may appear that hair is growing in thicker and darker after shaving, but that is because the fine tip of the shaft is removed and the thicker part of the shaft is visible as it protrudes. The protruding cut hair feels coarser once you touch it, all right? So shaving the terminal hair on a woman's face could be problematic, as the vellus hair would also be removed, and repetitive shaving stimulates terminal regrowth, especially with the onset of menopause. Additional problems are the potential for PFB, folliculitis barbae, which is a term for razor bumps, rash, and of course ingrown hairs, and folliculitis, which is an infection of the hair follicles. Both of these problems can be corrected by using clean razors, not shaving so close to the hair, so close that the hair, that the cut hairs drops underneath the skin, and not changing the direction of shaving. You know, it's actually recommended that men actually shave in the direction of the hair growth to not get any ingrown hairs versus against the hair growth. So shaving pros, again, inexpensive, it's convenient, it is fast, and it's painless. I mean, I think most of us have shaved at least once or twice, right? Shaving cons would be it causes a stubble hair growth in 1 to 4 days. Vellus hair also removed when terminal hair on the face shaved. may cause folliculitis, PFB in ingrown hairs, and you could potentially cut your skin. All right, chemical depilatories. Now, this is on page 466. Again, I mentioned this already. So a depilatory is a chemical substance spread on the skin to dissolve. It dissolves the hair on the surface of the skin. Again, this will be something like a Nair's or a Veet. Okay, I'm talking about a product brand here. On contact, the hair expands and the disulfide bonds of the hair break, and the hair can be wiped off or washed away. The active ingredients are alkaline, such as sodium hydroxide, potassium hydroxide, thioglycol acid, and calcium thioglycolate. Although depilatories are not commonly used, I think they're pretty commonly used. I think a lot of people still use Nair's. You should be familiar with them in case your clients have used them or are using them. If the depilatory is left on the skin longer than recommended, perhaps to dissolve coarse terminal hair on the face, dermatitis could result. So, as with any home care method, it is important to follow the manufacturer's recommendations and instructions. It can actually really irritate your skin if you leave it on too long. This will be, again, it's inexpensive. Can be very conveniently applied in the privacy of your own home. Regrowth is slower and softer than shaving, so that for sure. If you had to choose between shaving or using a chemical depilatory, I would say go for a Veet or a Nair's versus you shaving. It definitely is softer for sure. Some cons would be results are obviously not as long as when you wax. Strong odor, that is true. They all usually have a very distinct smell, okay? If you know, you know. If you used one before, you know what I'm talking about. Can cause irritation and later reactions such as contact dermatitis because, again, the skin's natural protective barrier is compromised as the depilatory is removed. And again, should not be used on non-intact skin. So, right, any open wounds, abrasions on your skin, common sense, you should not use a chemical depilatory. All right. Threading is an ancient method of epilation that began in the Middle East, and it is now rapidly spreading throughout the Western world. So I have all of this highlighted. Threading, also known as banding. You guys, in my state board test, I remember they asked me about threading, but they did not use the word threading. They used the word banding. So you want to remember banding or threading, that it's the same thing. Works by using cotton thread that is looped and twisted in the middle and then quickly, selectively guided along the surface of the skin, snagging the unwanted hairs in the twisted portion of the thread and epilating them. It is like using a really fast, rapid tweezer. Now, threading works. Threading is good, but I do find it to be quite painful. You obviously need a lot of experience when it comes to threading and knowing how to properly shape. Accomplished by using a two-handed technique. Okay, I do know of that as well. Or a hand and the mouth technique, which is what I was mentioning. The two-handed technique uses a closed loop and cat's cradle technique, where each end is looped around the thumb and forefingers. The thumb and forefinger of each hand alternatingly open and close, moving the twist forward and backward. The hand and mouth technique, which should not be performed as a professional service, loops the thread around the thumb and forefingers of one hand. Thumb and forefingers are gripping and grip a loose end, and the other loose end is placed in the practitioner's mouth and gripped by the teeth. Sounds complicated. The practitioner uses their head to maneuver the piece of thread. Licensing and regulations for threading may vary from state to state. Right, so pros for threading: fast, inexpensive method of hair removal, requires minimal products and supplies. The thread is discarded once it's used. Performed on clients whose skin cannot tolerate waxing. I'm one of those that sometimes can't tolerate threading, okay? So some cons, it can be painful as hairs are snagged in clusters. That's true. It should not be performed on vellus hair. Again, it's telling you to not perform any threading on that peach fuzz facial hair, okay? As it distorts the follicles, stimulating them to produce terminal hair over time. Again, is it 100% true? I can't say, again, based on experience, I don't find that to be 100% true. Sugaring. Sugaring is very popular as well. So sugaring is another ancient method of hair removal dating back to the ancient Egyptians' times. It is an alternative for those who have sensitive skin or who react to waxing with bumps and redness. The original recipe is a mixture of sugar, lemon juice, and water, heated to form a syrup consistency, which is then molded into a ball and pressed onto the skin and then quickly stripped away. The sugar can be used over and over on the same client until the hair left in the product interferes with the process. Then, of course, it is discarded. So sugaring is similar to waxing method, except that it uses a thick sugar-based paste, and it is especially appropriate for more sensitive skin types. One advantage of sugaring, you guys, is that the hair can be a little shorter than obviously with waxing, and we'll talk about that in just a second. Even if it's only at 1/16 to 1/8 of an inch long, without adhering to the skin, it can be removed in the direction of the hair growth, which is less irritating than waxing. It can be used for some who have certain wax contraindications as well. Sugar mixtures are now manufactured, which is, I purchased one myself in large quantities and sold in small containers ready to be placed in a heater. The sugar mixture melts at a very low temperature. It is hygienic because it is used on a specific client and then, of course, discarded. It's thrown away. True sugar products should be natural and resin-free. Additives in the formulas will change the results and effects on the skin. Sugaring uses both direction of applying and removing the product with the hair growth and against the hair growth. The application and removal depend on the product and the manufacturer's instructions. There are two types of sugaring methods. There is the hand applied and spatula applied. So the hand method, with the hand method, the product is held in the hand and applied against the hair growth, and it is removed in the direction of the hair growth. The application is similar to hard wax. The hand applied method is performed at body's temperature. 468, hand applied sugaring pros. Again, there is no risk of burning because it is applied at body's temperature. There is minimal risk of bruising as it does not adhere to the skin. So pull during the removal. Again, the hair doesn't need to be very long. No hair follicle distortion or breakage of hair because it is removed in the direction of the hair growth. Easy cleanup for the client. Again, naturally antiseptic properties inhibit bacterial growth. Please put a star next to the following. Easy cleanup of equipment, room, and treatment table as it is water soluble, which is what I just mentioned. You would just spray some water. If it happens to fall on the floor, you can just clean it up with water and it's right up. And inexpensive if it's homemade, right? Some cons would be slower and more time consuming to perform than soft wax, especially on larger areas. Now, again, you guys, if someone has been sugaring for several years, trust me, they're going to sugar you in 10-15 minutes, okay? So they are fast with it, but it does take some time to build the experience in really getting very quick at sugaring. All right, so I really would recommend additional training. Cons: not suitable for precise hair removal in such areas like eyebrows. So yeah, you will not use sugar wax on eyebrows, all right, because it's not precise. Folliculitis in ingrown hairs are possible, although considerably less with this method than with both the spatula apply method or the spatula applied sugaring method. This product is applied with the spatula in the direction of the hair growth and removed against the growth with a muslin or pellin strip. The spatula applied method is warmed according to the manufacturer's instructions, as it may be affected by additives like resins. Now, one of the things that I do want you guys to keep in mind, everyone waxes different, okay? And there, to me, I don't think there is, well, there are wrong ways of waxing for sure, but everyone has a different technique. And so yes, I'm on page 469. It talks about the spatula applied sugaring pros, the cons. You guys, I'm not gonna read through all of that, but it's there. Now, waxing. Waxing is the primary hair removal method used by estheticians. Wax is commonly used epilator applied in either soft or hard form. Both products are made primarily of resins and beeswax. Honey wax is the most common, okay, to which gum rosin is added. Wax is applied evenly over the hair and then removed. Hard wax is thicker than soft wax and does not require fabric strips for removal. The recommended time between waxing appointments is generally 4 to 6 weeks, dependent on the, again, anagen intelligent phases of the area being waxed and the percentage of hairs in the anagen phase. Waxing is addressed more fully later in this chapter. I gave you guys a list, and please confirm with me, someone, if I gave you guys the list of different wax brands. Guys, there's a lot of wax brands, you know, on the market in general. There's Borden, Starpill, Serapil, the Masiri brand, Wax and Relax, Wax Necessities, Ital Wax. There's a lot of different mermaid wax, easy wax. There's so many different wax brands out there that I would say try. A lot of these companies do sell samples. Of course, you do have to pay for shipping, but you know, that's not a problem if you're trying to find the right one. So again, to avoid trial and error, I can always recommend some that I like. That way you guys can go for it and see if it's something that you want to work with. But, you know, a lot of wax professional 5-pound or even 10-pound or more wax pots, they're, you know, a couple $100, you guys. $350 to $500 for a good wax pot. We'll say one thing, and again, everyone has different opinions. Everyone has different, you know, things that we like, all right? And for me, I actually don't mind, and I actually like using soft wax on legs. Again, just my preference, all right? It doesn't mean you have to like it, but I do like using soft wax on legs, and so I will do a demo, and I'm gonna have you guys do my legs with soft wax. So permanent hair removal and reduction, this is on page 470. So the methods of permanent hair removal and reduction are electrolysis, laser hair removal, okay? And intense pulse light, also known as IPL. Electrolysis is the only proven method of hair removal recognized and given the designation of permanent hair removal by the U.S. Food and Drug Administration, FDA, and the American Medical Association, as it is an effective method on all hair and skin types, okay? Laser and IPL have been given the designation of permanent hair reduction, as the effectiveness of both of these methods is dependent on the level of pigment, melanin, in the hair and skin. With laser hair removal, a laser beam is pulsed on the skin using one wavelength at a time, which impairs hair growth. It is an intense pulse of electromagnetic radiation. On page 470, please put a star next to the word electrolysis. Again, there are three main modalities that fall under the classification of electrolysis. Electrolysis, it's galvanic electrolysis, and the blend is another one. A combination of the two methods applied alternately, and the thermolysis uses alternating current, also known as AC, that is applied and omitted from the probe, inserted into the follicle of the hair to be eliminated to destroy the derma papilla. Galvanic electrolysis utilizes direct current, okay, from the probe, which creates a chemical reaction of sodium hydroxide, also known as lye, to cause a decomposition of the follicle. Electrolysis should be practiced only by a professional, certified, and licensed, and you have to be licensed. If the state does not license this profession, an electrologist should become a certified professional electrologist via the American Electrology Association. Okay. All right. Talk with your instructor for additional information about classes and licensing in electrolysis. Again, the National Laser Institute, if any of you guys were interested in furthering your education on laser hair removal, the National Laser Institute in Dallas would be, a place to go for that, okay? And then, of course, some pros and cons on electrolysis. Yes, ma'am. All right, so bottom of page 471, laser and intense pulse light. So both laser and intense pulse light offer permanent hair reduction. While these methods are sometimes called permanent, right? I know you guys have heard that. The hair bulb must be destroyed completely, or there may be some regrowth. Food and Drug Administration guidelines require that these procedures be defined only as permanent hair reduction, okay? The word laser is an acronym for light amplification by stimulated emissions of radiation. Lasers used intense pulse of electromagnetic radiation that, in the case of hair removal, are attracted to and heat up pigment, that is melanin. The best candidates are those with dark hair and minimal pigment in the skin. Conversely, those with gray hair are the least favorable candidates, as their hair would not respond because the laser is designed to target pigment. Oh, well, here it goes. Fitzpatrick, I was going to start talking about darker Fitzpatricks. So Fitzpatrick's 4 through 6 will be less favorable candidates in comparison to Fitzpatrick's 1 through 3, because the former have increased pigment in the skin and therefore a greater risk of burning and hyperpigmentation. You definitely have to go to someone that is trained and knows how deep they can go and what kind of laser is best for your skin type, okay? Please put a star next to different from a traditional laser. Intense pulse light produces a quick flash of light. These short, powerful pulses shatter their target without allowing heat to build up and burn the surrounding skin. Both laser and IPL are normally performed in a medical setting or under medical supervision. Although local regulatory agencies regulate who can use these devices. Again, laser, IPL pros, both methods offer a fast, long-lasting hair reduction treatment. no risk of disease transmission from blood, not considered as uncomfortable as electrolysis, though this is subjective. Obviously, everyone has a different pain tolerance. Regrowth is often finer in texture and lighter in color. Some cons would be it's a costly treatment, requiring an average of 3 to 6 or more treatments. Issues of long-term safety and effectiveness. Safety concerns for the eyes and the need of protective eyewear. Uncomfortable for some people. No guarantee of satisfaction. You may not like it. Okay, or you may feel like, oh, my hair is growing back. Inadequate and inconsistent state regulatory controls and guidelines. Okay. All right, let's keep moving on. Page 473. Explain when to use hard wax, soft wax methods of hair removal. So waxing services are one of the most popular services in salons and spas, and still the most common form of hair removal. There are two types of waxes. Hard wax, there's no strip, is used for this removal. Soft wax, which uses a strip for removal. Both waxes have different qualities that make them a preferred choice for different kinds of hair removal services. Estheticians generally use soft wax in larger areas, such as the back and legs, and they use hard wax in smaller areas, such as eyebrows, the axillas, which is your underarms, and bikini area. Wax formulas are made from rosins derived from pine tree resin, okay? Beeswax, paraffin, honey, and other waxes and substances. Please put a star next to the following. They may also include additives such as azulene and chamomile for sensitive skin, or tea tree oils for soothing and antiseptic benefits. Wax products' consistency vary, as do melting points, okay? It is important to keep the wax at the temperature recommended by the manufacturer so that it works effectively and optimally. Leaving the wax unit on overnight or overheating the wax diminishes the effectiveness and may cause injury. Both hard wax and soft wax regrowth is softer and there is no stubbly feeling. Regrowth generally takes 6 to 8 weeks after waxing. So hard wax essentials. Hard waxes are available, you guys, in blocks, discs, pallets, or beads. Generally, the harder the wax, the more heat is required to melting it. They're based on a resin called rosin that is often combined with beeswax as well as candelilla, and carnauba waxes to modify the melting point and provide increased strength. The used wax is obviously discarded after each service. Put a star next to the following and highlight it. Hard waxes are gentle enough for facial area, yet strong enough to be used on hard to remove coarse hair in areas where the hair growth converges from multiple directions. Some like to use it on the bikini and underarm areas. Hard wax is thicker than soft wax. Pre-treatment for hard wax. Cleanse and prepare the client's skin with products recommended by the manufacturer of the wax, as they're formulated for optimal results with cotton and cleaner or makeup remover. Remove all traces of makeup on the area that you are going to be waxing, as makeup can be an irritant and can prevent the wax from actually sticking to the skin, to the hair, okay? So for larger areas of the body, such as arms, legs, and back, a spray cleaner containing the wax manufacturer's recommended products. There's a lot of different products you can use to pre-cleanse, or a general antiseptic product such as witch hazel, is faster and more economical. The wax method generally requires a thin application of pre-wax oil to protect the skin. It should be absorbed and not leave an oily film. So especially when working with hard wax, we are going to use a little bit of oil on the skin. Now, not to leave the skin extremely oily, because if you could just imagine, if you use too much oil on the skin, then the wax is not going to stick to the hair, okay? You're applying the oil to protect the skin and to moisturize it, okay, and to prevent it from lifting the skin, which can cause tears and obviously bleeding, which is not what we want, all right? You are also going to oil your gloves. You're going to oil your gloves, okay, to help you, okay, and to stop you from sticking to the glove as you are performing these services, okay? That's just a little tip. Hard wax technique. So hard waxes are applied with an applicator at a 45 degree angle directly to the skin in a thick, wet appearing layer that hardens as it cools, okay? It is first applied against the hair growth, then back over in the direction of the hair growth in a figure 8 pattern, like frosting a cake. This is done to ensure that each strand of hair is completely coated. As hard wax is not as thin as soft wax, it does not run under the hair as soft wax does. As the wax hardens, it tightens, it grips the hair, and then lifts it off the skin. The esthetician then grips the wax at one end and pulls it while it still feels a little tacky. The gripping is helped by creating a tab, slightly thicker wax at the end where the pull originates. So again, it's called creating a lip, right, on the wax when you apply it. And you can actually see a picture of it on page 474, all right? Hard wax can be removed in the direction of the hair growth, thus the follicle is not distorted. It can also be removed against the hair growth or even sideways to the direction of the hair growth. It is especially effective in areas where hair grows in multiple directions, like the underarm, okay? The hair grows in different directions in the underarm, or in thin or fragile skin. Therefore, application and removal depends on the area to be waxed and how coarse the hair is, as well as the individual's manufacturer's instructions for their brand of hard wax. Hard wax can be applied to an area a second time during the service. Now, the reason why it's saying that, you guys, is because when you're working with soft wax, it is not recommended that you wax over the same area more than once. But when you're working with hard wax, you can wax over the same area multiple times. Now, if the skin is very irritated and very red and is already having pin bleeding, then you will obviously not want to keep waxing over it, now would you? So again, common sense, but yes, you are able to wax over the same area more than once when you are using hard wax only, okay? So hard wax post-treatment care. It is uncomfortable to remove remaining pieces of hard wax by picking them off. That's true. They should be removed with a post-treatment oil. Products containing chamomile, tea tree oil, or aloe vera can provide a soothing aftercare. Please put a star next to that. That is a question on your Chapter 11 test. So hard wax do's. Do follow recommendations for heating the wax. Do test the wax prior to use on the client. Always ask if the temperature of the wax is okay. Not only do you check it first, but you also want to make sure the client is comfortable. So you always want to ask them. Apply the wax with a clean borders to avoid leaving wax behind after the removal pull. Apply the wax to the thickness of the nickel with no visible hair beneath it. Now, there are some brands of wax that you're able to apply pretty thin and it will still lift really nicely, versus other waxes where you do have to make your application a little bit thicker in order for your wax not to crack, okay? Again, check for contraindications with the client and obtain a signed release form. Hard wax, don't. Do not overheat the wax or leave the heat on overnight. Do not apply wax to a client without testing the temperature for safety first. Do not double dip a spatula, okay? You have to discard, throw your spatula away after each use, okay? Again, do not reuse the wax. Ew, okay? Do not apply wax inside the ear, canal, or nostrils. Now, soft wax essentials on page 475. Soft wax is the most common method of hair removal. There are multiple brands which varies additives for the face and other body areas and levels of sensitivity, but they are predominantly made of rosins that adhere to the skin. Professionals' soft waxes have a lower melting point and come in cans, although some come in plastic bottles for single client use with roller heads for application in place of a spatula. Soft wax has the consistency of honey when melted and ready for use. Soft wax, when applied in a timely manner, run down and around the around the hair while also adhering to the skin, and must be removed immediately with a piece of muslin or pelon while still warm. Okay, see on page 475 where it says caution. Some regions may prohibit the use of a roll-on wax. They're called roll-on waxes. So again, contamination in the wax and proper disinfection of the applicator. So bottles of wax with roller applications must be single use, okay? They are used on a client and then the roller must be disinfected prior to its use on another client. Make certain to check with your state board regulatory boards and OSHA to be in compliance. So pre-treatment for soft wax. Cleanse and prepare the client's skin. Again, manufacturer's recommended products. If there's no makeup to be removed, a product such as a witch hazel can be used. If waxing the face, a thin film of tea tree oil can be applied to protect the skin and minimize redness, followed by a dusting of baby powder to ensure the area is dry and oil free. Okay. Soft wax techniques. Soft wax should be tested also with powder. I only use powder on the skin if someone is excessively sweaty. Okay, so it just depends. And that obviously is very common when you're doing Brazilians, bikinis, and when you're waxing the underarm. But I would not apply powder on someone's eyebrows, for instance. Okay. Soft wax technique. So soft wax should be tested for, again, correct and safe temperature and consistency before being applied to the client. Using an appropriate size applicator for the area, apply a thin coating of wax in the direction of the hair growth by swiftly gliding the edge of the applicator, again at a 45-degree angle across the area, allowing the wax to slide off the applicator as it moves across. Quickly place an appropriate size muslin or pelon strip over the area. Make sure there is a wax-free portion at the pulling end of the strip to grip it for removal. You guys, I will show you and demonstrate all of this, but obviously we have to kind of read it, right? Rub firmly over the strip two to 3 times in the direction of the growth. Place one hand firmly on the skin at the pulling end while using the other hand to grab the strip and swiftly pull it close and parallel to the skin, back against the direction of the hair growth. Immediately after the pull, apply gentle pressure to the area. Removing soft wax in the incorrect direction can have serious consequences, as will waxing over an area a second time during the same appointment. It's something you do not want to do. All right, so blending. Please put a star next to blending on page 476. Blending is a technique that utilizes the wax that has built up on the actual strip to remove the more obvious hairs while leaving shorter hairs behind. It produces a gradual demarcation line between the completely hairless and then obviously some hairs. Post-treatment care for soft wax. So residual stickiness is common after working with soft wax, and it should be removed with the soothing wax removal lotion. Puffiness, mainly in the upper lip, is possible. Can be treated with aloe, ice in a bag, or cold stones immediately following the service. Hey, what about our cold roller? Remember that one? Hives can also occur and can be avoided subsequently if the client takes an over-the-counter antihistamine. Speed waxing. So speed waxing is the quick application and removal of soft wax. It is known as speed waxing. Speed is more comfortable for the client. Faster procedures save time, lead to more revenue, and ensure more satisfied clients. And you always want to follow the manufacturer's instructions when it comes to heating the wax. Wearing gloves, apply the wax again in the direction of the hair growth. Remove the wax stripped against the direction of the hair growth. Some soft wax don'ts. So do not apply the wax without testing it first. Again, pretty much the same don'ts as all the other type of waxes. Okay. What else? On page 477, selecting the right wax for the best service. So the pros and cons of hard wax and soft wax helps determine the most suitable wax for the client and the area to be treated. So let's just read a few of them. So facts about hard wax. Hard wax, when removed in the direction of the hair growth, does not distort the follicles. Some facts about soft wax. Soft wax is removed against the direction of the hair growth and distorts hair growth. Regrowth stands to attention rather than to lying flat. Hard wax does not adhere to the skin and therefore causes less irritation. Soft wax adheres to the skin and can cause redness and irritation. With hard wax, the area can be waxed a second time during the service, provided there's no irritation. With soft wax, on the other hand, you cannot be waxed a second time during the service time. Eyebrows may be waxed with hard wax if topical prescriptions such as Retin-A or Differin are being used by the client but have not been applied directly to the eye area. Soft wax, on the other hand, cannot be used anywhere on the face if prescriptions such as Retin-A or Differin is being used by the client. So again, read the chart. It has a lot of helpful information that obviously may come in handy. In the handouts that I gave you guys, there's a whole list of contraindications and also different medications that if your client is on, you should not perform waxing services on. Facial waxing during facials. Eyebrows or upper lip waxing can be performed during a facial, but it should be done after the cleansing, gentle exfoliation, steam, and extractions, and before the mask. Waxing should not be performed if any aggressive exfoliation has taken place or over an area where extractions were performed. The mask should be soothing. If the indicated mask therapy is not going to be soothing, then the soothing lotion and cool damp cotton should be applied to the waxed area, and the area should be avoided with the mask. All right, so we are going to stop on page 478 where it says provide a thorough client consultation.